Attention future nurses. Did you know that most NCLEX failures don't happen because students aren't smart enough, but because they keep making the same 10 mistakes over and over again? Not practicing enough questions. Ignoring rationales. Relying only on memorization. Forgetting prioritization. Mismanaging time. Second-guessing themselves. Neglecting pediatric growth and development. Confusing medication safety rules. Overlooking delegation and safety. And not reviewing after practice. If you want to pass the NCLEX, you must learn from these mistakes. The best way? Constant practice with tough NCLEX-style questions, just like the ones we do right here on this channel. So stick with me, practice along, and don't skip, because every single question could be the one that makes the difference on your exam day. Stay till the very end and test yourself on all 50 questions. You might be surprised at how many you get right. Question 1. A 6-year-old with acute glomerulonephritis is admitted. Which assessment finding is most concerning? A. Periorbital edema. B. Blood pressure of 160/100 mmHg. C. Hematuria. D. Fatigue. Answer: B. Blood pressure of 160/100 mmHg. Rationale: severe hypertension is the most dangerous complication and can cause seizures or encephalopathy. Strategy: in renal disorders, prioritize blood pressure and fluid overload over chronic symptoms. Question 2. A 9-month-old is admitted with suspected intussusception. Which finding supports this diagnosis? A. Ribbon-like stools. B. Current jelly stools. C. Projectile vomiting without bile. D. Olive-shaped mass in RUQ. Answer: B. Current jelly stools. Rationale: this stool type, blood plus mucus, is pathognomonic for intussusception. Strategy: on NCLEX, associate current jelly equals intussusception, olive mass equals pyloric stenosis. Question 3. A 4-year-old is admitted with suspected meningitis. Which intervention takes priority? A. Keep the child NPO. B. Place child on droplet precautions. C. Elevate head of bed. D. Monitor for seizures. Answer: B. Place child on droplet precautions. Rationale: preventing spread of meningococcal infection is the immediate priority. Strategy: NCLEX tests infection control first before treatment steps. Question 4. The nurse is caring for a 2-year-old with a ventriculoperitoneal (VP) shunt. Which finding is most concerning? A. Flat fontanelle. B. Sleepiness during nap time. C. Irritability and vomiting. D. Occasional fussiness. Answer: C. Irritability and vomiting. Rationale: signs of increased intracranial pressure and possible shunt malfunction. Strategy: look for subtle neurologic changes in pediatric neuro questions. Question 5. A child with cystic fibrosis has frequent respiratory infections. Which intervention is essential? A. Avoiding all dairy products. B. Chest physiotherapy before meals. C. Restricting fluids to prevent secretions. D. Placing the child on strict bed rest. Answer: B. Chest physiotherapy before meals. Rationale: airway clearance before meals reduces aspiration risk and improves nutrition. Strategy: in CF, airway plus pancreatic enzymes plus high-calorie diet are priorities. Question 6. A 5-year-old with leukemia is receiving chemotherapy. The absolute neutrophil count, ANC, is 400. Which action is most appropriate? A. Restrict fresh fruits and flowers in the room. B. Encourage daily outdoor play. C. Continue routine vaccinations. D. Provide a regular diet. Answer: A. Restrict fresh fruits and flowers in the room. Rationale: ANC less than 500 indicates severe neutropenia, strict infection precautions are necessary. Strategy: when ANC is critically low, always think infection prevention. Question 7. A 10-year-old with sickle cell crisis reports severe abdominal pain. Which intervention is contraindicated? A. Administer 4 morphine. B. Encourage oral fluids. C. Apply warm compresses. D. Restrict activity and keep child NPO. Answer: D. Restrict activity and keep child NPO. Rationale: hydration is critical to relieve vaso-occlusion. NPO is unnecessary unless preparing for surgery. Strategy: in sickle cell, avoid cold, dehydration, or unnecessary restrictions. Question 8. Which developmental milestone is expected for a 24-month-old child? A. Uses 2 to 3 word sentences. B. Copies a circle. C. Balances on one foot for 5 seconds. D. Knows right from left. Answer: A. Uses 2 to 3 word sentences. Rationale: by age 2, toddlers combine words into simple phrases. Strategy: remember 2 years equals 2 word sentences, 2 steps, 2 blocks. Question 9. A 7-year-old with type 1 diabetes is scheduled for a soccer game. What is the best snack before playing? A. Peanut butter on crackers. B. Diet soda. C. Sugar-free candy. D. Hard-boiled egg. Answer: A. Peanut butter on crackers. Rationale: provides carbohydrate plus protein for sustained glucose during exercise. Strategy: for NCLEX, pair complex carbs plus protein in diabetic children pre-exercise. Question 10. A 3-year-old with epiglottitis presents to the ER. Which action should the nurse avoid? A. Keep emergency intubation equipment at bedside. B. Encourage the child to sit upright. C. Insert a tongue depressor to examine the throat. D. Provide humidified oxygen. Answer: C. Insert a tongue depressor to examine the throat. Rationale: can trigger laryngospasm and complete airway obstruction. Strategy: for airway questions, identify what can worsen obstruction. Question 11. A 16-year-old with cystic fibrosis is admitted for pulmonary exacerbation. Which nursing diagnosis has highest priority? A. Impaired social interaction. B. Ineffective airway clearance. C. Imbalanced nutrition, less than body requirements. D. Risk for infection. Answer: B. Ineffective airway clearance. Rationale: airway issues are always priority over psychosocial or risk factors. Strategy: ABCs first, airway always trumps. Question 12. The nurse is preparing to give a vaccine to a 12-month-old child. Which is contraindicated? A. MMR. B. Varicella. C. HIB. D. Influenza live nasal spray. Answer: D. Influenza live nasal spray. Rationale: not given under age 2, only injectable inactivated influenza vaccine is appropriate. Strategy: memorize live vaccine contraindications by age and immune status. Question 13. A 15-year-old with anorexia nervosa is admitted with HR 48 BPM, BP 82/54, and severe weight loss. Which intervention is priority? A. Daily psychotherapy sessions. B. Cardiac monitoring and stabilization. C. Nutrition counseling. D. Family education. Answer: B. Cardiac monitoring and stabilization. Rationale: bradycardia and hypotension place patient at risk of cardiac arrest. Strategy: for eating disorders, prioritize cardiac complications before psych care. Question 14. A child with hemophilia falls and hits his knee. Which intervention is best? A. Apply cold compress and immobilize. B. Apply warm compresses. C. Encourage ambulation. D. Massage the joint gently. Answer: A. Apply cold compress and immobilize. Rationale: cold plus rest helps reduce bleeding in joints. Warmth increases bleeding risk. Strategy: think rice, rest, ice, compression, elevation, in bleeding disorders. Question 15. A nurse is caring for a 5-year-old with suspected leukemia. Which diagnostic test confirms the diagnosis? A. Complete blood count. B. Bone marrow biopsy. C. Chest X-ray. D. CT scan of head. Answer: B. Bone marrow biopsy. Rationale: definitive diagnosis requires bone marrow aspiration showing blast cells. Strategy: NCLEX loves definitive diagnosis, pick the most direct test. Question 16. A 4-year-old with suspected rheumatic fever is admitted. Which assessment finding best supports this diagnosis? A. Strawberry tongue. B. Sandpaper rash. C. Migratory joint pain. D. Koplik spots. Answer: C. Migratory joint pain. Rationale: classic feature of rheumatic fever along with carditis and chorea. Strategy: match hallmark symptoms, don't confuse rheumatic fever with Kawasaki or measles. Question 17. A 6-month-old with bronchiolitis has an O2 saturation of 88% on room air. Which is the nurse's first action? A. Suction the nasal passages. B. Administer a nebulized bronchodilator. C. Start chest physiotherapy. D. Restrict fluids. Answer: A. Suction the nasal passages. Rationale: infants are obligate nose breathers, suctioning improves airway before oxygen or meds. Strategy: always think airway patency before pharmacology. Question 18. A 13-year-old with type 1 diabetes presents with Kussmaul respirations, fruity breath, and confusion. Which lab result confirms DKA? A. Glucose 160 mg per deciliter. B. pH 7.28. C. HCO3 26 milliequivalent/L. D. Sodium 140 milliequivalent/L. Answer: B. pH 7.28. Rationale: DKA causes metabolic acidosis, pH less than 7.35, HCO3 less than 22. Strategy: always confirm diagnosis with ABG, not just glucose. Question 19. The nurse prepares to administer IM vaccines to a 6-month-old infant. What is the preferred site? A. Deltoid. B. Vastus lateralis. C. Ventrogluteal. D. Dorsogluteal. Answer: B. Vastus lateralis. Rationale: safest muscle for infants due to adequate size and low risk of nerve damage. Strategy: for NCLEX, infants equals vastus lateralis, toddlers equals vastus or ventrogluteal. Question 20. A 3-year-old with nephrotic syndrome is admitted. Which finding is most concerning? A. Proteinuria. B. Periorbital edema. C. Decreased urine output. D. Respiratory distress. Answer: D. Respiratory distress. Rationale: severe edema can lead to pleural effusion and impaired oxygenation. Strategy: with edema questions, choose the complication that affects breathing first. Question 21. A child with suspected Duchenne muscular dystrophy is being assessed. Which finding is typical? A. Positive Babinski reflex. B. Gower sign. C. Hyperreflexia. D. Ataxia. Answer: B. Gower sign. Rationale: using hands to push off thighs when standing is characteristic. Strategy: NCLEX likes classic disease signs, memorize hallmark features. Question 22. A 7-year-old with asthma is receiving albuterol. Which side effect requires immediate intervention? A. Tremors. B. Insomnia. C. Heart rate 180 bpm. D. Restlessness. Answer: C. Heart rate 180 bpm. Rationale: severe tachycardia suggests toxicity. Strategy: differentiate expected side effects, tremor, jitteriness, from dangerous toxicity. Question 23. A nurse is teaching parents of a toddler with iron deficiency anemia about diet. Which meal is best? A. Milk and bananas. B. Hot dog with white bread. C. Chicken and broccoli. D. French fries and juice. Answer: C. Chicken and broccoli. Rationale: provides heme iron plus vitamin C for absorption. Strategy: pair iron-rich plus vitamin C for best answer. Question 24. A 14-year-old with scoliosis is scheduled for spinal fusion. Which finding requires reporting? A. Hemoglobin 7.9 G/dl. B. Reports of back pain. C. Uneven shoulder height. D. Menarche at age 13. Answer: A. Hemoglobin 7.9 G/dl. Rationale: severe anemia must be corrected before major surgery. Strategy: always check lab values before surgery, low hemoglobin is unsafe. Question 25. A 12-year-old with bacterial meningitis suddenly develops a purpuric rash and cool extremities. What should the nurse suspect? A. Allergic reaction. B. Disseminated intravascular coagulation, DIC. C. Dehydration. D. Viral exanthem. Answer: B. DIC. Rationale: purpura plus shock symptoms in meningococcemia suggest life-threatening DIC. Strategy: on NCLEX, a rash with systemic collapse equals emergency clotting disorder. Question 26. A 5-year-old receiving chemotherapy develops oral mucositis. Which intervention is best? A. Use lemon glycerin swabs. B. Offer popsicles. C. Provide spicy foods to stimulate appetite. D. Encourage frequent toothbrushing. Answer: B. Offer popsicles. Rationale: cold relieves pain and swelling, avoid acidic or irritating agents. Strategy: always eliminate options that worsen pain, spicy, acidic, harsh swabs. Question 27. Which toy is most appropriate for a hospitalized 6-year-old in isolation for chickenpox? A. Stuffed animal from home. B. Board game that can be wiped clean. C. Playroom shared toys. D. Interactive group game. Answer: B. Board game that can be wiped clean. Rationale: avoid cloth toys and shared materials due to infection control. Strategy: for isolation, pick easily disinfected, single-patient use toys. Question 28. A newborn is diagnosed with tetralogy of Fallot. During a TET spell, what is the first intervention? A. Place infant in knee-chest position. B. Start 4 fluids. C. Administer oxygen via mask. D. Give morphine sulfate. Answer: A. Place infant in knee-chest position. Rationale: increases systemic vascular resistance and reduces right-to-left shunting. Strategy: TET spell knee-chest first, then O2, then meds. Question 29. A nurse cares for a child with suspected Reye's syndrome. Which history finding is most significant? A. Recent aspirin use for fever. B. Peanut allergy. C. Recent MMR vaccination. D. Exposure to varicella at school. Answer: A. Recent aspirin use for fever. Rationale: aspirin in viral illness is the classic trigger. Strategy: memorize NCLEX traps, aspirin equals rise. Question 30. A 16-year-old with cystic fibrosis requires pancreatic enzyme replacement. When should the nurse administer it? A. 1 hour before meals. B. With each meal and snack. C. Only at bedtime. D. Before respiratory therapy. Answer: B. With each meal and snack. Rationale: enzymes must mix with food to aid digestion. Strategy: timing of meds matters, NCLEX loves when to give. Question 31. A child with a ventriculoperitoneal shunt develops sudden irritability and a high-pitched cry. What does this indicate? A. Normal post-op pain. B. Increased intracranial pressure. C. Separation anxiety. D. Gastroesophageal reflux. Answer: B. Increased intracranial pressure. Rationale: early signs in infants are irritability and high-pitched cry. Strategy: for PEDS neuro, subtle behavioral changes equals red flags. Question 32. The nurse assesses a toddler with suspected lead poisoning. Which finding supports the diagnosis? A. Microcytic anemia. B. Hypercalcemia. C. Increased reflexes. D. Low potassium. Answer: A. Microcytic anemia. Rationale: lead interferes with hemoglobin synthesis anemia. Strategy: associate lead poisoning equals anemia plus developmental delay. Question 33. A 14-year-old reports recurrent nosebleeds. Which lab value is most concerning? A. Platelets 45,000/mm superscript 3. B. Hemoglobin 11G/DL. C. WBC 6,000/mm superscript 3. D. Hematocrit 35%. Answer: A. Platelets 45,000/mm superscript 3. Rationale: severe thrombocytopenia increases bleeding risk. Strategy: no critical lab cutoffs, platelets less than 50K equals bleeding risk. Question 34. A newborn with tracheoesophageal fistula suddenly coughs, chokes, and turns cyanotic during feeding. Which is the nurse's first action? A. Continue feeding slowly. B. Stop feeding and suction airway. C. Elevate head and keep feeding tube in place. D. Notify the provider after feed. Answer: B. Stop feeding and suction airway. Rationale: classic triad for TEF, immediate airway management is required. Strategy: with airway anomalies, stop feed plus suction plus notify. Question 35. The nurse prepares to give an 4 antibiotic to a child with a history of anaphylaxis to penicillin. Which order should be questioned? A. Azithromycin. B. Ceftriaxone. C. Vancomycin. D. Clindamycin. Answer: B. Ceftriaxone. Rationale: cephalosporins cross-react with penicillins in some cases. Strategy: always watch for drug class cross-allergies. Question 36. A 6-year-old with diabetes insipidus is receiving desmopressin. Which finding requires immediate reporting? A. Polyuria. B. Headache and confusion. C. Dry mucous membranes. D. Increased thirst. Answer: B. Headache and confusion. Rationale: may indicate water intoxication and hyponatremia. Strategy: for ADH meds, watch for fluid overload, not dehydration. Question 37. The nurse is caring for a child post-tonsillectomy. Which assessment is most concerning? A. Refusing to drink fluids. B. Vomiting small clots. C. Frequent swallowing. D. Complaints of sore throat. Answer: C. Frequent swallowing. Rationale: silent sign of postoperative bleeding. Strategy: look for subtle bleeding indicators rather than obvious ones. Question 38. A 5-year-old receiving chemotherapy is scheduled for an intramuscular injection. Which action is best? A. Use the deltoid site. B. Use smallest needle possible. C. Question the order. D. Administer deep into muscle quickly. Answer: C. Question the order. Rationale: IM injections avoided in thrombocytopenic/immunosuppressed children. Strategy: eliminate unsafe procedures for vulnerable patients. Question 39. Which child should the nurse assess first? A. 2-year-old with croup and inspiratory stridor at rest. B. 5-year-old with asthma using accessory muscles while talking. C. 9-year-old with cystic fibrosis producing thick green sputum. D. 13-year-old with pneumonia and fever 101.5 degrees Fahrenheit. Answer: A. 2-year-old with croup and inspiratory stridor at rest. Rationale: indicates severe airway obstruction and risk of respiratory failure. Strategy: prioritize airway compromise over infection or fever. Question 40. A 15-year-old with ADHD is prescribed methylphenidate. Which parental statement indicates understanding? A. Will give it at bedtime to help him sleep. B. Will watch for loss of appetite and weight loss. C. Will give extra doses on weekends. D. Will stop if he feels more focused. Answer: B. Watch for loss of appetite and weight loss. Rationale: common side effects of stimulants. Strategy: NCLEX loves med safety teaching, no key side effects. Question 41. The nurse is caring for a newborn with hypoglycemia. Which finding is expected? A. Jitteriness. B. Bradycardia. C. Hypothermia. D. Diarrhea. Answer: A. Jitteriness. Rationale: classic sign of neonatal hypoglycemia. Strategy: for newborn metabolic disorders, no hallmark presentation. Question 42. A 2-year-old with pneumonia is receiving 4 antibiotics. Which finding suggests therapeutic effect? A. Increased WBC count. B. Decreased respiratory rate. C. Persistent crackles. D. High fever. Answer: B. Decreased respiratory rate. Rationale: improvement shows in vital signs before labs. Strategy: NCLEX often wants earliest improvement sign. Question 43. A 12-year-old is admitted after ingestion of acetaminophen tablets. Which lab is most important? A. AST and ALT. B. Platelet count. C. Serum creatinine. D. Amylase. Answer: A. AST and ALT. Rationale: liver damage is the main complication of acetaminophen overdose. Strategy: match poison target organ, Tylenol liver. Question 44. A nurse cares for an infant with pyloric stenosis. Which finding is expected? A. Bile-stained vomit. B. Olive-shaped mass in RUQ. C. Current jelly stools. D. Projectile diarrhea. Answer: B. Olive-shaped mass in RUQ. Rationale: classic hallmark of pyloric stenosis. Strategy: pair olive mass plus projectile vomiting with pyloric stenosis. Question 45. A 7-year-old with spina bifida has a latex allergy. Which item must be removed? A. 4 tubing. B. Rubber tourniquet. C. Glass thermometer. D. Paper tape. Answer: B. Rubber tourniquet. Rationale: latex commonly found in rubber products. Strategy: always associate spina bifida equals high latex allergy risk. Question 46. A 2-year-old is diagnosed with measles. Which nursing intervention is appropriate? A. Negative pressure isolation. B. Standard precautions only. C. Droplet isolation only. D. Protective isolation. Answer: A. Negative pressure isolation. Rationale: measles spreads via airborne transmission. Strategy: memorize which childhood infections equals airborne precautions, measles, TB, varicella. Question 47. A child with Down syndrome is scheduled for surgery. Which pre-op assessment is priority? A. Assess for congenital heart defects. B. Assess for scoliosis. C. Assess for seizures. D. Assess for clubfoot. Answer: A. Assess for congenital heart defects. Rationale: high prevalence in Down syndrome and affects anesthesia risk. Strategy: for syndromes, memorize common associated conditions. Question 48. A nurse assesses a toddler with suspected epiglottitis. Which is the best immediate action? A. Insert oral airway. B. Call anesthesia for possible intubation. C. Give nebulized epinephrine. D. Start 4 antibiotics immediately. Answer: B. Call anesthesia for possible intubation. Rationale: securing airway is priority before giving meds. Strategy: in airway emergencies, don't delay intubation. Question 49. A 10-year-old with hemophilia A is admitted after a fall. Which treatment is anticipated? A. Desmopressin, DAP. B. Factor VIII replacement. C. Vitamin K injection. D. Fresh frozen plasma only. Answer: B. Factor VIII replacement. Rationale: hemophilia A equals factor VIII deficiency. Strategy: match the factor deficiency to the correct treatment. Question 50. A nurse is assessing growth in a 6-year-old child. Which finding requires further evaluation? A. Weight gain of 2.5 kilograms per year. B. Height increase of 5 centimeters per year. C. BMI below 5th percentile. D. Loss of primary teeth. Answer: C. BMI below 5th percentile. Rationale: indicates undernutrition/failure to thrive. Strategy: growth charts are critical, extremes, 5th or 95th percentile, equals concern. Well done, future RN. You've just practiced some of the most difficult pediatric NCLEX questions designed to challenge your critical thinking. Now, let me ask you. How many questions did you get correct out of 50? Drop your score in the comments, I want to see how well you did. Remember, every time you practice, you're one step closer to beating the NCLEX. Keep learning, keep practicing, and never fall into the top 10 mistakes that fail students. If you found this helpful, don't forget to like, subscribe, and share this with another nursing student who needs it. See you in the next video, and remember, success on NCLEX is about practice, not perfection.